far.
There you go.
Yeah, that little thing came on the side. Okay, so today we're going to do T-spine, sacrum, and coccyx. Okay. Patient prep, they're going to need to change into a gown because we're going to be basically all over the whole body. Take everything off. Can leave their underwear on as long as there's not any metal in them. Jewelry-wise, belly button rings and necklaces are the only thing we're worried about. Necklaces and chains. Those are the only two things that'll be in the way. Okay. We're going to approach this what we think would be best patient care-wise. You may or may not see things done this way at clinic, but we're going to do all the APs and then roll her up and do all the laterals. Some people, I've read an article and some people were saying that they're not taking that approach now, some because of the digital aspect, so that they can keep all the T-spine together and all the sacrum together and all the coccyx together. But you can do is move around. It's a couple extra buttons to push. I think the patient's more important than inconveniencing yourself to change a couple of buttons on the machine. I think that's a big deal, but anyway, so we're going to do all the APs first and everything. So I'm going to let my patient go ahead and lie down on the table. We will be using the sheet because she would be in a gown. This was all kind of torn up, but we'll get a fresh one for her when we get ready to check off. Okay, I'm going to bring the table up to the working height. .40 inches to the bucky and locked in transversely. All right, we want to be perpendicular. Going to start with the AP T-spine. Going to use the 14 by 17 lengthwise. We're going to use the full 17 inches of length and then be 8 inches wide. Okay. Now, if you're in here with these cassettes, the easy way to know 8 inches is going to be if you'll place your marker, the inside part of the blocker, put the blocker at the bottom and then just put it on this edge that's towards the inside. We'll use the right marker here. You could use the left, but if you don't have to go to the inside cassette, I don't like to because the markers get caught and you can lose a marker in the bucky. As a matter of fact, you know what they told me? They said, I think it was Sarah, I think she said, hey, there's a marker up in there on the bucky, and there was one laying on the bucky when I went to put a cassette in the other day where it didn't come off the cassette and it was stuck up in the bucky. So, I mean, I would have figured it out when the cassette didn't go in, but she could see it from where she was sitting. So I'm going to place it here. Who will be out there next week? Yes, next week.
You said next week, but I'm thinking this week.
Next week you'll be out there. I'll show you about some marker placement things afterwards, and I'll show you about the table and everything. So don't leave without me showing you all the stuff. Y'all always stay anyway, but make sure I show you all that. Okay. All right. We want to think of the and line this up. Think of doing the APT spine like we would a chest. That was actually on your test today. So we want to center at T7. We can, kind of roll our patient up and find inferior angle of scapula, or if we remember from doing a chest that if we put an inch to an inch and a half of the cassette above the shoulder, generally we'll be in pretty good shape. And so that's a way to kind of double check this. You want your patient to have a pillow, but you've got to make sure that the pillow is not up underneath the shoulders at all, because if it gets into the spinal, it will shadow. So under the head, but not underneath the shoulders. And I can look at this, I'm going to come back down just a little bit, and tell when I'm up that I'm going to get the lower part of her C-spine. I can tell that when I look at it, and I can pull my cassette out and look where the top is, which is about an inch or so above the shoulder. The bottom part is here, which is almost to her crest, so I know I should have T12. Okay, but feel free to roll the person up and find inferior angle and bring your hand down, and that's fine too if you want to do that. Or you're 3 to 4 inches below the jugular notch, if you want to do that. I want to make sure my patient is straight on the table, hips and shoulders in alignment, so that when I go to measure center mid-sagittal plane, I'm in good shape. So I'll go mid-sagittal plane. I can account where her hands are. And I think in your textbook they do this one on expiration. I don't know why. I'm going to take you to do it on inspiration. So we're going to take in a breath and hold it. That way, the diaphragm goes down. We get most of the thoracic spine in the chest. None of it's down in the abdomen, which affects your exposure factors. And you get that dark air of the lungs kind of around the spine to give you some contrast. So deep breath in and hold it. And that will be our APT spine. From there, I'm going to do the AP Sacrum. I'm going to use the 10 by 12 lengthwise. Going to keep the 8 inches wide and take the full 12 inches of length. So I'm 8 by 12. Marker placement, since it's only 10 inches wide, you go about to the middle of the blocker, your marker should show up. Like I said, I'll show y'all. There's a single place you can put yours and leave it the whole time, which is nice. Okay. Now for AP Sacrum, I need to have what angle?
15 degrees.
15 degrees cephalic. And then I'm going to center mid-sagittal plane halfway between ASIS and symphysis. And then be sure, and here is that we have to realign constantly. Okay?
Center between ASIS and symphysis.
And symphysis. So I found greater trochanter and I went halfway in between ASIS and greater trochanter at the mid-sagittal plane. Yeah, but don't want to be palpating any symphysis. No, thank you. Miss Chastity would not want that.
He goes, what are you doing?
I did it on my husband. Just because I wanted to like see, you know, what he was like, what are you doing? And I was like, whatever your status is.
He goes, well, stop it.
And then I had my other one up.
This is all about x-ray. Stop what you're doing now.
He said, do you have to do that? And I said, no, you never palpate for that.
Then why are you doing it?
Yeah.
Because you're my husband and I can.
I was like, I just want to see, you know.
How much it really does line up.
Yeah.
Because you want, you know. Okay, and then I'm going to have her hold her breath here. The phase of respiration isn't going to matter, but she does need to hold her breath because that's in the abdomen area, so we will get motion as she breathes.
Can we keep it consistent? Just like taking a breath and holding it?
Yes, definitely. Do inspiration, hold on if you want to, that's fine. Okay. Now from the AP Sacrum, we'll do the AP Coccyx. I'm going to leave my 8 inches wide. I'm going to collimate down to 10. It's not much, but I'm going to collimate down a little bit. And then what's my central ray for this?
10 caudal.
Yes, 10 caudal. And I want to center where this is on the chest too. 2 inches above the symphysis.
Yeah.
Don't be surprised if you're not almost exactly back where you started from.
Center where now?
2 inches above the symphysis. That's your great trick.
We'll leave the marker in the same place, like in the middle of the.
Yes, you can leave the marker in the cassette, everything just like it is. Okay, you can relax.
So you said 8 inches wide and 10 inches in length?
Correct.
Yes.
Okay, that was good.
But don't be surprised if you find yourself in about the same spot you were before, because that 2 inches above the symphysis is about halfway between the symphysis and the ASIS. Not on everybody. I think you're a little short-waisted through here. It's not quite the same on her, but I'm just saying that so that if all of a sudden you've done it and you're like, I'm exactly back where I started from, don't let that freak you out, because you may very well be exactly where you were on the sacrum, just in the opposite direction. And then just be sure that you realign again. I had to -10 myself Monday. Not Monday, the first lab on Tuesday. I said, oh, gross error. -10. I only did it once though. I didn't do it again after that. Happens to the best of us.
Yeah, because then you can't think about anything else once you do that.
So, we good with that? So that's all our APs. APT spine, AP sacrum, AP coccyx.
You're still doing on inspiration.
Yes.
Taking on inspiration.
Yeah, inspiration. As long as you hold the breath The face doesn't matter, but if you want to just be consistent, yes, inspiration's fine. Okay. I'm going to take my angle off. I'm going to go ahead and open back up to the 12, and I'm still 8. I'm 8 by 12. I'm going to ask my patient to roll up on her left side. Do you need a comfort swing?
No.
Okay. Roll up on her left side, knees on top of each other and bent, and arms up like she's sleeping.
8 by 12, you said?
Yes. So this is like in a sleeping position here. Straight. I want to keep hip and shoulder in alignment. So I'm going to slide her back up here. So I see hip and shoulder in alignment. She's in a good lateral position. We're going to do sacrum coccyx together, lateral together. In leaving open the 12 inches, we can center like we would for just the sacrum, lateral sacrum, and we'll be able to get the coccyx. It'll fit on there if we leave the full 12. So I'm going to find the ASIS.
So what's this one called?
This is a lateral sacrum coccyx.
Okay.
We're going to center at the level of the lateral, the level of the ASIS, and about 3 inches posterior to the ASIS, or roughly, I'm roughly in the coronal plane. So it's 3 to 4 inches posterior to the ASIS at the level of the ASIS. Realign. Okay, I'm going to change my marker though, because this is the left lateral. I need to use the left marker, and when we do the laterals, we always want to mark to the anterior surface. Okay, so to cheat, it's not really cheating. I'm going to turn the blocker around so that I know where I want to put my blocker, or my marker, and I can go halfway, because now my blocker's at the top. But I want to always mark my laterals toward the anterior surface. And if you're looking at it and you're not sure and you think, oh, am I going to have everything or not? Look at it and kind of see. You can see where the top of my cassette is and the bottom of my cassette is really, I've got her whole butt on there basically. So I should feel good about making sure I have the coccyx on there as well. But just double check that. You won't see any light on the back. You really shouldn't. If you see light on the table, then you're centered too far posterior. Okay? And be sure that you use the lead masking for this one. I'm going to place it behind her at where my light field is, but not up underneath her. I don't want it in contact with my patient or underneath my patient, just up close. Okay. If you get it up under the patient and it ends up in your light field at all, it can affect the quality of your image if you're doing digital imaging. Because, particularly with a cassette, because it'll read the whole exposure, including trying to be dark enough to get the lead. And then when it re-averages, it can make your whole image dark. So be careful of that. Okay? And then she would hold her breath again. Whatever phase you want, because we're still in that area. Everybody good with that? From this, we're going to do the swimmers, because I still want my 10 by 12. I'm going to leave my marker the same, my collimation the same, and leave everything the same. And just come up and in center for the swimmers, okay?
So 8 by 12?
Yes, 8 by 12, left marker toward the anterior surface. I am going to put a 5-degree caudal angle on my tube.
5-degree caudal.
Realign to my bucky, because I'm going to kind of run out of space here a little bit with where her shoulder is. All right, I'm going to ask her to bring her right arm down by her side, and it's good to just, I tapped her arm too when I said right. Of course, it'd be really hard to get that left one down by your side when you're laying on it. The left one needs to stay up towards her head like she's asleep, like she had it before, okay? But this one down by her side. Want to make sure she doesn't roll and she stays in a good lateral position. Make sure that the spine is straight, the neck stays straight. The table will come down far enough. See? And I want to center. For this one, y'all might want to get up and kind of look at this because it's really hard to see when you're just sitting. Okay? I want to center so that my central ray, I'm a little too low. I'm going to have to step on the pedal when I get over here. I'm going to find the base of her neck and her shoulder. Step on that release button. And I want to be centered halfway in between. So halfway in between the base of her neck and the shoulder. Okay. Now, I want to make sure, I got to make sure she stays straight. This is to get from C5 to T5. And so I want to make sure I'm going to get the T-spine. But notice, and this is normal for most people, notice how her neck is kind of at an angle here. But I want to make sure I get all her neck on here. All you have to do to straighten her up is kind of pull that arm back. And now you've got the whole neck on there too.
Okay.
And make sure that they don't roll back. Make sure the neck stays straight. She's pretty level. I had to change out. We had the big pillow yesterday, and it was bringing Miss Hutz's head way up. And so her head was at an angle, which was not going to be good. So I got back to the thinner one, and her hands underneath her, that's fine. If this looked like it was elevating her head too much, then I would have her take her hand out. Because you want the neck to be straight through here. Okay? So this is the positioning for it. You have the option on this one. You can shoot this on suspended respiration, holding your breath, or it can be done breathing if you want to, but it's a little more complicated setting a breathing technique for this, but they turn out really nice breathing. Okay? You don't have to use the lead masking here because part of this is through the neck and it's not really quite as wide, but if you want to use it for all three for consistency's sake so you don't forget, it's okay to do that. And that will be the swimmer so that we get the upper part of the T-spine. Okay? Was that I think that was better having y'all come up here to see that.
Yes.
Because you really can't see that from here. All right, I'm going to have her just keep in this exact same position, and I'm going to swap out my cassette to do my lateral T-spine. Now for the lateral T-spine, back to the 14 by 17 lengthwise. And just like I did before, I'm going to put the blocker at the top now and then put my marker toward the inside part of that so it'll show up. We're going to come back perpendicular. Realign to my bucky. And I'm going to take the full 17 again. So now I'm 8 by 17 again. Okay. Now, while her arm is still at her side, because this is a more relaxed position, I want to find the inferior angle of her scapula so I can send her up to that pretty easily here. So I'm going to find the inferior angle of the scapula. Now I'm going to ask her to take this right arm, put it back on top of the left. Okay. Now, this is what you have to watch. Watch when she did that. She got herself all comfortable, but she's pulled herself forward, so she's not lateral now. Okay. So I've got to watch and keep those shoulders on top of each other and no rotation. And now I've got to check for sag. Okay. The sag wasn't important for the other two really, but it is going to be important here. So I'm going to check to make sure she doesn't have any sag. If she does not, she's good, no sag. If she had sag, here we have the nice small sponges that you can slide up underneath there. If you were at clinic, a towel or a sheet, something radiolucent will be fine to lift that up. But the same thing that I talked about happening with the lumbar spine today would happen with the T-spine, seeing the tops and the bottoms if you had sag. Okay.
And use the lead masking.
Yes, definitely use the lead masking here. And like I said, you know, we've only got this one piece here, but we put there's a glove in there already. We put a glove in the digital room so you can use a glove. You could use the extra half apron we have, anything like that would work. But again, behind and close, but not in contact or underneath. Okay. And I want a mid-coronal. This is what I was talking about with the lateral lumbar too. Make sure that you're mid-coronal or mid-axillary, whichever you want to call it. And you'll see some light kind of sliding off the edge here. That's okay, but you probably are not going to see any on the table. Trust that, because as you pointed out, Stacy, when the patients get large, that light field can get really small. But look, I haven't changed where I'm at. So just be sure you center to the mid-coronal plane and trust that. You don't have to open it up to 10 inches. You don't have to do any of those extra things. Trust where you're supposed to be. Now, this one should be shot with a breathing technique. So I'm going to ask her to hold still and breathe normally. So I want her to breathe normally. you would need to use at least 2 seconds of exposure time so that you can blur the ribs and blur the lung markings and get a good look at the spine.
2 seconds.
Yes. So that is what you'll check off on next week. So 3 APs, 3 laterals. No anatomy, but we will shoot an image. We'll shoot an image. Pat doesn't like to lay on her side, so it won't be. It'll be one of the 3 APs. Because Pat can't really stay up on her side very well by herself. So we'll do that. Any questions? Thank you so much, my excellent patient here. Slide this over.